Hello, my name is Dr. Stephanie Paulmeno. I'm a public health nurse, a gerontologist, a licensed facility administrator, and president of the Connecticut Nursing Association. For the last 20 years, I've also been a member of the disaster mental health team of my local chapter of my Red Cross. I'd like to speak today to the people who are on the front line of the pandemic crisis. I've been in situations where I've experienced some of the stress you have, and I would like to talk to you about some of the things that I've learned along the way. Pandemics are such all-encompassing events. They affect everything in our way of life. If you look at where we are now with shut-ins and people not being able to go to work and businesses closing, you think of the impact on people's wages and ability to earn and put food on their table. You think about the impact of public safety and people's own concern for their personal safety and the safety of their loved ones and family members. We know that pandemics completely overwhelm the healthcare system because the numbers grow so rapidly. We know that morbidity and mortality is not equal. So if you're a worker in one of the groups that are more heavily burdened, in our case, Black, Hispanic, and people of lower income, how are you feeling being on the front line? Is that, I would imagine, an added stress for you? Now, in situations like this, healthcare workers are called upon to work out of their comfort zones. You may be working in a location you're not familiar with populations or age groups you've not worked with equipment that you've not used, or perhaps had some just-in-time training to learn how to use at this point. So all of this adds to the additional stress. But we do know that people who work in disaster situations and on the front lines in crises like this have a lot of issues that come up. There's a lot of research on it. We know that such people are at higher risk for mood and coping disorders, for post-traumatic stress disorders, for substance use and misuse as people try to self-medicate against the things that they see and hear and feel. We know that the incidence of attempts and actual deaths by suicide increase, and we know that working long-term in situations like this can have an impact on relationships people have. We also know that these impacts come across several areas. In the cognitive area, people working for prolonged periods under these conditions of duress can have impaired cognition, impaired concentration, feelings of indifference, unbending sense that they become more rigid, perfectionistic. They may become preoccupied with the event. Some people will deal with the emotional issues of guilt and fear and anger and rage. Some people may feel detached. Others may feel overwhelmed with sorrow and feelings of helplessness. In the behavioral end, there are people who will have impacted problems with sleep, not being able to fall asleep or stay asleep, or appetite dysfunction. These, are signs of depression and anxiety. Some people will have intense emotions that will roll back and forth, crying, tearfulness, things of this sort. And then there are situations that are physical. People will experience tachycardia, dyspnea, aches and pains. People whose health conditions have been stabilized may find them suddenly not so stabilized, perhaps because their immune systems, under the duress and stress that you folks are working under, become less effective. So I would ask you, what is it that healthcare workers need who are on the front lines under these conditions of duress? And I would tell you they need what everybody else needs. They need to feel safe in their environments. And we know that you don't feel safe in your environments because you're lacking the personal protective equipment and supplies and the proper staffing. We don't actually know what extent the disease burden is in this country because we haven't done enough testing to get that information. We know that people want to feel calm and in control, and it's hard to do that under the circumstances we just described. We know that people want to feel effective in their roles. And again, you may be looking at this in a very global sense and thinking, how can I be effective when all these numbers are rising? But I would ask that perhaps you look at these things in a different light. Perhaps you can look at a patient who got better, someone whose symptoms got improved, somebody who went home, and feel effectiveness in a smaller sense. We need to feel connected to people. And We need to be connected to our colleagues and to our family members. People need to have a sense of hopefulness that this is going to be over and we're going to return to some sense of normalcy. It may not be exactly what we have known it to be up to now, but we are going to get through this. 80% of the people who develop a coronavirus disease are going to recover, and they're going to recover because of the work you're doing. So I would ask you to look at some cognitive behavioral therapy approaches, reframe the situation you're in, look at things from a different perspective, and when you do that, you can respond to them differently. I would ask that you create a self-care plan. Acknowledge that you are not superhuman. You need to take breaks. You need to eat and drink and sleep. You need to recognize the signs in you that you might be feeling overwhelmed. Take a periodic self-inventory. Monitor both yourself and your colleagues. Reach out to one another. This is a time for compassion. Talk to one another. You're sharing a unique experience and a unique bond, and you have a lot to offer each other. You also can take part in all kinds of stress management techniques. First of all, if you're listening to news, put it away for a while. Do relaxation breathing, imagery, exercise, fresh air, meditation. Talk to people and see if you can pull yourself into a better place. And I thank you. I couldn't thank you enough on behalf of everybody for what you're doing, for your courage. We are so proud of you. We're here for you. And there are many people in your local politicians, your local leaders, organizations who are trying to get the supplies and things that you need to feel safe. Stay well. God bless.